The Nurses Association of Jamaica, NAJ, is raising concern about news that an employee at the St. Anne's Bay Infirmary was tested positive for COVID-19. The association's president, Carmen Johnson, says persons who came in contact with this individual must get tested as soon as possible. Shamela Pullen reports.
On Tuesday, news surfaced that an employee at the St. Anne Infirmary was tested positive for COVID-19. TVJ News cannot reveal much about the employee due to privacy issues, but the Nurses Association of Jamaica NAJ President Carmen Johnson says she's concerned.
So if we really have an employee who had COVID-19 and not knowing it and been working, then it tells us that we are not in a safe position at this given point in time, because there are a number of patients there, very populated, and it seems to me this employee would have been around more than one other employee and would have gone amongst the patients, and so it poses a challenge.
It's a challenge because the infirmary houses more than 100 residents, most of whom suffer from underlying medical conditions such as diabetes and hypertension. Ms. Johnson says she would not want an outbreak at the facility or to hear that any resident has succumbed to the illness.
One of the big concerns is that, remember, those who are in the upper age group may have one or two comorbidities. They may have some other chronic illnesses. Number two, as you age, your resistance, your immunity gets weaker than a younger individual. And so you being elderly maybe have a comorbidity, your resistance being weak, some of those persons in the infirmary are not able to walk about or to move out of the area. And so what you find is that they are at risk of coming down with the disease much more readily than a younger individual may come down with it.
The NAJ president calls for stricter measures to be put in place and for those who have come in contact with the affected individual to get tested as soon as possible.
I think we mean that you'll now have to go into high gear, red gear, to make sure that you are minimizing the exposure to the greater number of persons. One of the things that they maybe need to do is for those patients who are able to manage themselves with a mask, is to give them a mask from now. You may have patients there who can move their hands to fix it and wanting to suffocate underneath it. But what I want is that for persons, the monitoring individuals, give them their masks at this given point in time, ensure that employees are washing their hands as often as they can, and ensuring that you are creating some space between the residents where possible.
Infirmaries have not been accepting new residents or visitors since the coronavirus outbreak in Jamaica. Shamela Pullen, TVJ News.